Okay, going on to Tuesday, doctors and specialists. Who are they and what do they do? Does anybody really know? I'll tell you, as a survivor in this community, I hear some people say they see a vascular specialist. I do not have a vascular specialist on my team. It's part of the aortic disease center that I go to. I've never seen a vascular specialist. I've only seen my thoracic surgeon and my cardiologist, but evidently there's hypertension specialists. There's all different types of doctors. So I'm sure that if I'm confused, and many of you are confused, but have you ever wondered exactly what types of doctors are supposed to be managing your care and being part of your team? And what exactly do these doctors treat? What about other types of specialists? So we're going to talk a little bit about the common names for these specialists and what exactly they do. And this should just give you a moment to pause and think about your own team. And if you have questions, if you're missing someone, talk to your primary care or talk to your cardiologist, talk to somebody. But let's talk about it. So a cardiologist, we all have heard of a cardiologist, but you need a cardiologist who understands aortic disease. Because typically a cardiologist will help treat pain. And they obviously will work with high blood pressure and heart failure, as well as other problems with your heart valves, with blood vessels and other heart and vascular issues. So they can also perform a TEE, which is a transesophageal echocardiogram, transesophageal echocardiogram. Say it 3 times fast. Maybe you'll win a prize. All right, so that's your cardiologist. I typically go to my cardiologist. This is just me for anything. She is the overriding decision maker on cold medicine, on supplements, on anything. I do nothing without discussing it with her because I know that I could take a simple supplement in my mind and it might have an adverse reaction to my medication she's prescribing. So I like to have that open conversation and dialogue with her often. And I know that if I'm having a problem with my medications, she's going to be the one that's going to tweak everything and be like the cardiac chemist. Cardiac chemistry. Let's create that. That's a new job title. All right, moving on. Let's talk about a cardiothoracic surgeon. So this is somebody who specializes specifically in operating on the heart or the lungs or other thoracic chest related organs. So they're anything that's in that upper chest area, cardiothoracic surgeon. It's who I had do my surgery. Although some people have said that when they've had a type A, they've actually had a vascular surgeon. So I'm not sure how much they go hand in hand. Let's keep going. This is all in no particular order except that it's in alphabetical order. There you go. Genetic counselor. So a genetic counselor will actually assess a patient's risk for a variety of inherited conditions. So they're going to sit with you. They're going to talk with you about your family medical history, something that Think Aorta preaches all the time. They're going to ask you about your immediate first-degree relatives, and they're going to piece together this big, huge flowchart looking thing that they develop by having open communication with you, and they're going to go back and determine the risk. And then in that department, they'll make the decision on what, if any, types of genetic testing would be performed and to whom. Okay. Internist, otherwise known as GP, general practitioner, otherwise known as PCP, or primary care physician. This is the doctor who's going to help you manage all aspects of your health. This is soup to nuts. This is everything. And they usually can help coordinate care with your specialist. So, for instance, my primary care told me she is the spine of the book and the pages are the specialists. So she's kind of holding all of that together, which is why they want you to have your medical records sent to your PCP or internist or family doctor, your main doctor. Because they're going to take a look at it with a different set of eyes. They're going to look at the CAT scan, not just from a cardiac perspective, from an all over body systems, and look to see if there's anything that needs additional follow-up. Now, that's what your primary care doctor is good for. They're good for a lot more than just a cold. I mean, if you have a cold, you can go to an urgent care. But a primary care, a really good doctor is going to sit and have the conversation with you about your entire body system, stay on top of your immunizations, etc. So it's really valuable to have one of them on your team. And I did not for about 7 years because I didn't understand the value. It's because I didn't have the right doctor. And now I do. Okay, moving on. LCSW, LCSWC. So now we're into the therapeutic side of the medical industry. And an LCSW stands for Licensed Clinical Social Worker. If they have the additional C, that means clinical. It's an extra certification. It's an extra step in their process. And so they're actually going to assess you and treat a variety of mental health disorders, including generalized anxiety disorder, medical trauma, or PTSD. Now, they are not the ones that would typically be dispensing or prescribing medications. That's going to be more of your psychiatry, but they are going to assess you for any type of mental health disorder and then provide treatment options. So LCSW, LCSWC. In some states, I think it's LPC. There may be another letter in there that I'm missing. So they may be a little variation state to state on the credentialing. And you might want to take a look at that in your own state. Okay, here's another doctor that you might end up seeing. Nephrologist. A nephrologist will actually diagnose and treat kidney conditions and kidney failure. So some of us, I know when you've had your dissection, your kidneys became impacted. And so you would end up seeing a nephrologist possibly. Neurologist. So a neurologist is going to be the doctor that you're going to see that's going to treat diseases of the brain, your spinal cord as well, peripheral nerves and muscles. So these conditions could include stroke. It can include a trans ischemic event. So this could be a TIA, a trans ischemic attack, or complex migraine. So when some of these neurologists have different titles as well. You're going to have some people that focus and specialize in strokes, and others that specialize in cognitive disorders, some that specialize in migraines. But that all falls under neurology. And just because we're talking about these does not mean that you're going to end up seeing all, or you may only see one or two. So it doesn't mean that you're lacking in care. There's a lot to mention. Thirsty. All right. Ophthalmologist. Why would I see an ophthalmologist when you're part of the aortic disease world? Because they treat a variety of eye conditions such as retinal detachments. And I'm sure we've all heard about this, or glaucoma, or cataracts, lens issues. That tends to happen in the Marfan community. A lot of us that do not have a diagnosed genetic disorder are still found to have had a retinal detachment. We become at risk for this. So I don't remember all of the reasons why we're at risk for this. I just know that it's happened to many people, including myself, but that's who you would see. And as far as my personal follow-up, I'm seen yearly to make sure that my retinas look good. Once you've had a detachment, you are at higher risk to have another detachment. So it's important that you add that in if you've had one, and you make sure that you're having your follow-ups on your eyes as well. Phlebotomist. I think we all know by now that the phlebotomist is the person that is going to draw your blood, and they're checking for kidney functions before you have a CT scan. Especially if you're having a CT scan with dye, they need to know that your kidneys are functioning properly. That dye, that IV contrast, weighs pretty heavily on your kidneys. Not so much the gadolinium that comes with a MRI, but definitely the ones that come with the CTAs. They also might be taking a look at your INR, which is your international normalized ratio, and that is a blood clot timing test. And that's typically for people that are on blood thinners, not Plavix. We're talking Coumadin and warfarin is what I believe. That's what they're checking on. Okay, continuing, a radiologist. Radiologists are going to be performing your CT scan, your MRA, your MRAs. They may also be doing your echoes as well. So they're going to perform the test, and then there will be a doctor of radiology that will read those results and then provide those results to the ordering physician. So your sonographer is really what the specific name is for the person who's doing your echo. That's considered like an ultrasound. Your sonographer is going to perform that test, and then the final results will be provided to the ordering physician. Okay, vascular surgeon. A vascular surgeon specializes in blood vessels and veins that are not associated with the heart. However, they do specialize in surgeries related to aortic aneurysms and aortic dissections. So that confused me because stuff that they do, stuff that they don't do, but that they do stuff doesn't matter. I don't need to understand it. I just need to know, do I have all the right people on my team? And for me, I know that I do. So this is, again, not meant to confuse you. This is meant to just describe some other specialist names or categories you might not have heard of and the reasoning why. So if there's somebody that's on your team that's not listed, we'd love to hear about it. And we'll see if we can add it to the list. I think it's important for us to know. It's a lot of conditions. I mean, that's a lot of doctors handling a lot of conditions. Pretty interesting topic Tuesday.
That's a good list. Karen Heichel says hello.
Hello, Karen. Hello, hello.
I
It's so
said,
sweet.
I
Nice
said,
meeting
how
you.
are you? What you knitting? And she goes, knitting a blanket square. I was like, part of a bigger
She,
project. She says,
yes.
yes, 1 square a month,
Yeah.
have a blanket in the air, making one for each of the grandkids.
Oh, that's going to take some time. That's
Right?
going to take. I wonder, Karen, if you've ever done what's called a temperature blanket. I'm sure you've heard of it. I tried to do that on a loom, a round loom. And what you do with the temperature blanket, which is kind of cool, is for a year, you determine what color yarn you want to equal temperature ranges. And it's not like, okay, 80 has to be red. 80 could be blue. 40 could be pink. You decide whatever it is. And then based upon that day, that's the color yarn that you use to loom that once. So you just knit that color for the day. And then the next 365, you should definitely have a nice blanket. But as soon as I forgot, I was behind a week. I'm trying to looking up what the temperature was all week. Like this, I'm not doing this. I need instant gratification. Give me a pot holder. I do that really fast, or a hat. But
Or a hat.
yeah. Well, and so you could do that. You could say to yourself, I'm going to do the average of a week. 52 weeks is definitely going to be enough to knit a hat, and it could be your temperature hat. It's kind of cool. 2023, this is what the average temperature was for the year in different weeks.
She
Kind of
says
fun.
yes.
See, she knew. I
She
knew
says
she'd
yes.
know. I
I
knew she'd know.
I said, that sounds lovely. I miss my knitted blanket back in kindergarten. It was the last time I was allowed to nap in school. What kind of trick is that, Karen? 1 year
Yeah,
of napping, and then it's like, no naps. There's no
I know
naps.
they take it away fast. And nap time was a great time. And I think they should reinstate it definitely in high school because we're tired. We're tired and we need a nap before 3 p.m.
Karen
for
goes,
sure.
it's called heaven or retirement.
Yes.